go through how to mix alginate, and then in a separate video how to pour up those alginate models, and then how to make retainers and whitening trays. So if the dentist is going to need to mix alginate, it's usually in a cupboard like that, and then the alginate is in a box like this. Okay, so out first. So our equipment is the alginate, the mixing bowl, the mixing spatula, and then some water bowls. I don't use the water bowls, but some people do. And then also we want to make sure that the dentists have their trays. So our trays are kept over here. So the trays are kept over here. These are the disposable trays. And then the metal trays are in here. Okay, so the bottom trays, it's separated into bottom trays and top trays. So this is the bottom trays. So got a bit missing for the tongue, and then the top tray. So usually for Asian people, what we found is a Fox 2 or a Fox 3 is the perfect size. So around here, let's say we do a Fox, I'd say a Fox 2 for me, because I'm just gonna, you would usually give this to your dentist, okay? So let's say I pick a Fox 2 for the bottom and a Fox 3 for myself, but the dentist pick probably an upper and lower 2 and an upper and lower 3, and then the dentist will try it in before using it and then just see whether it fits or not. Okay, so that's the top and bottom. Around there, at least you have a set. And then we go into this room. So what I'm going to do is, let's say I'm going to mix. So grab some gloves. I'm going to try not to make a mess. So grab some gloves, grab a bib, and lie it on a bench, so it's going to make it easier for you to clean up in a bit. Okay, have the trays there. Generally, we don't need any adhesive for these trays. This is the alginate adhesive, if it's, for example, a plastic tray, but generally I found that we haven't needed to use that. This is the alginate. And then basically what I found is I mix like this. So generally for most people, 2 to 3 scoops. Like for a child, 2 scoops, 3 scoops for an adult, and then 4 scoops if their mouth is really large. So let's just do 3 scoops for now. Looks like this. And then I just look at the water myself and put it in. But how much water do you put in, Jordan, if they're going to use the measuring cups?
So half a cup is for 1 scoop. So if it's 3 scoops, it will be 1.5 cups.
So I would always put a little bit less, because we don't want so 1 cup, 1 scoop, 2 scoops, and then so 3 scoops. So I would go 1. So I'd go 1 and maybe a quarter of water. So we can do 1 like that, how Jordan said. So make sure the water is cold, okay? And then we do so like this. So that is, and then that's 1 1/4 like this, okay? And then pour it in. And then how we mix it is exactly like mixing a cake, okay? So we just try and mix it so that all of the powdery stuff is not powdery anymore. So there is no powdery, like no light pink powder anymore, and it's all purple. Okay, so like that. So see how that's actually a very good consistency, very good water mixture, like it's not too runny. So that's how you do it. And then we try and squash the alginate against the side like this. So this is how I'm mixing, so that there is no bubbles at all. Okay, so like this. Okay, that's about all the time that we need to mix. We don't want to mix it for longer because this is set by time. So then we put it in the trays like this. Like that, okay? And then you would usually give it to your dentist, okay? So let's say I have now become the dentist and I'm also the patient, okay? So then what happens is the dentist will put it in the patient's mouth like this. and then it will set. And then Jordan, can you go through cleaning this while it's setting?
So when we finish scooping it out, we want to grab a paper towel and just wipe off the thing on the spatula first. Otherwise, when it sets, it will be really hard to take it off. As for the ones in the bowl, we can leave it until it sets, and then it will just fall off by itself afterwards.
Put it in the bin, don't put it in the sink. Can you say that again for me?
So when we finish wiping it off, just make sure that you put it in the bin and not in the sink.
Because
If it goes into the sink, it will block the sink and it will clog it. So we can just tap the alginate to check if it's set. So it's not very set yet, so we'll just leave it a bit longer. And then when it's set, we'll just grab another paper towel and then we'll wipe it all off. So I usually have a bib here so that I can wipe the alginate onto the bib and then just chuck the whole thing into the bin afterwards.
Is it set?
Yeah, so if we just wipe it now, it should all come off pretty easily. So if it hasn't set, it'll be in a liquid form, and you just gotta give it some more time to set, and then it'll come off like this.
And let's put it in a bin.
Yeah. Okay, and just like that, and that's it. And then the rest, you'll just discard all of it into the bin.
And then you the dentist would have taken the impression out of the mouth, and then make sure you help the dentist by giving them a wet paper towel, because there's going to be like stuff all over the patient's face. That's normal. Help them wipe it so they don't walk out looking like they ate something purple. Okay, and then the impression's going to look like this. Make sure you wrap it in a wet paper towel if you don't have time to pour up the impression straight away. So what that means is like this, but there's a spray as well that you spray it. Okay, so it's in stereo. So you basically would take it in like one of these or like a bib, and then you take it to stereo. You spray it. So stereo is over there. So you spray it with like Cavicide, like it says Cavicide. You spray it to make sure that it's got like no germs on it and stuff. And then you can wrap it in a wet paper towel, which is like, you know, like just wet a paper towel in water, and then you wrap it up, okay? So that it will it will not distort if you can only pour up the stone in, let's say, up to 3 hours time, okay? Yeah, you can stop that.